Jaundice is a medical condition that causes a yellowish tint to the skin and the whites of the eyes. This yellow discoloration occurs due to an excess of bilirubin in the bloodstream. Bilirubin is a yellow pigment that forms when old red blood cells break down. Normally, the liver processes bilirubin and removes it from the body through bile, which is eventually excreted in the stool. However, when the liver is not functioning properly, or when there's an issue with the breakdown or removal of bilirubin, it builds up in the blood, leading to jaundice. The yellowing of the skin and eyes is the most recognizable sign of jaundice, but the condition is more complex than just this visible symptom. Jaundice itself is not a disease, but rather a symptom of an underlying issue. It can indicate a range of health problems, from relatively harmless conditions to more serious liver diseases. The prevalence of jaundice varies depending on the age group and underlying causes. It's extremely common in newborns, affecting up to 60% of full-term babies and 80% of premature babies in the first week of life. This type of jaundice, called neonatal jaundice, is usually harmless and resolves on its own. In adults, jaundice is less common, but can be a sign of more serious conditions. Causes of jaundice. Jaundice is categorized into three main types, based on where the problem occurs when your body is processing bilirubin. The three main types of jaundice are prehepatic jaundice, hepatic jaundice, and posthepatic jaundice. Prehepatic jaundice occurs before the liver gets involved in processing bilirubin. The most common prehepatic cause is hemolytic anemia, which is a condition where red blood cells break down faster than usual. This leads to an increased production of bilirubin that can overwhelm the liver's ability to process it. Other prehepatic causes include genetic conditions that affect red blood cells, such as sickle cell disease or thalassemia. Hepatic jaundice involves problems with the liver itself. These can range from infections like hepatitis A, B, or C to more chronic conditions like cirrhosis or alcoholic liver disease. In these cases, the liver's ability to process bilirubin is impaired, leading to its buildup in the body. Some medications can also cause liver damage and result in jaundice. Posthepatic jaundice, also known as obstructive jaundice, occurs when there's a blockage that prevents bile, which contains processed bilirubin, from leaving the liver and entering the intestines to be expelled. This can be due to gallstones blocking the bile ducts, tumors in the pancreas or bile ducts, or other conditions that compress or obstruct the bile ducts. In newborns, jaundice is often physiological, meaning it's a normal part of the newborn period. Newborn babies have more red blood cells than they need, and as these extra cells break down, they produce more bilirubin than the baby's still developing liver can handle. This usually resolves on its own within a week or two. Symptoms of jaundice. The symptoms of jaundice can vary depending on the underlying cause and the severity of the condition. The most obvious symptom, as mentioned earlier, is the yellowing of the skin and the whites of the eyes. This yellowing typically starts on the face and spreads downward to the chest, abdomen, and legs as bilirubin levels increase. In darker-skinned individuals, the yellowing might be more noticeable in the whites of the eyes or the inside of the mouth. In addition to yellowing of the skin and eyes, jaundice can cause dark urine and pale stools. Normally, bilirubin is excreted from the body in the stool, giving it its brown color. However, when there is an issue with bilirubin processing or excretion, the stool may become lighter in color, while the urine may become darker due to the excess bilirubin being filtered by the kidneys. This is particularly common in cases of posthepatic jaundice, where bile flow is obstructed. Many people with jaundice also experience fatigue and weakness. This isn't directly caused by the bilirubin itself, but rather by the underlying condition causing the jaundice. For example, if jaundice is due to liver disease, the liver's reduced function can lead to a general feeling of unwellness. Itching or pruritus is another common symptom, especially in cases of obstructive jaundice. This occurs because bile salts, which would normally be excreted, build up in the skin. The itching can be intense and distressing, often worse at night and on the palms of the hands and soles of the feet. In some cases, jaundice can be accompanied by abdominal pain. This is more common in cases where jaundice is caused by gallstones or pancreatic disorders. The pain might be a dull ache or more severe, depending on the underlying cause. Some people with jaundice might experience nausea, loss of appetite, and weight loss. Again, these symptoms are often more related to the underlying cause of jaundice rather than the jaundice itself. It's important to note that in mild cases, especially in infants with physiological jaundice, there might not be any noticeable symptoms other than the slight yellowing of the skin and eyes. However, in severe cases, particularly in newborns, jaundice can lead to a serious condition called kernicterus, where high levels of bilirubin damage the brain. This can cause symptoms like poor feeding, lethargy, high-pitched crying, and in severe cases, seizures or loss of consciousness. Diagnosis of jaundice. Diagnosing jaundice typically begins with a physical examination. Your doctor will look for the yellowing of the skin and eyes, and may press on the skin to see if the yellow color blanches or temporarily fades. They'll also ask about other symptoms and medical history. Blood tests are crucial in diagnosing jaundice and identifying its cause. The first step in diagnosing jaundice is usually a blood test to measure bilirubin levels. Elevated bilirubin levels confirm that jaundice is present, but additional tests are needed to determine whether the problem is prehepatic, hepatic, or posthepatic. Liver function tests are commonly used to assess how well the liver is working and to identify any liver damage or disease. These tests measure the levels of liver enzymes and proteins in the blood. Elevated liver enzymes may indicate liver inflammation or damage. If an obstruction of the bile ducts is suspected, imaging tests may be used to look for blockages or abnormalities in the liver, gallbladder, or bile ducts. Ultrasound is often the first imaging test performed, as it is non-invasive and can easily detect gallstones or tumors. For newborns, a special device called a transcutaneous bilirubin meter can measure bilirubin levels through the skin without needing to draw blood. This is often used as a screening tool, with blood tests used to confirm high levels if necessary. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for jaundice. The treatment of jaundice depends on its underlying cause and severity. In many cases, especially with newborns, no treatment is needed as the condition resolves on its own. However, for newborns with significant jaundice, phototherapy is often used. This involves exposing the baby's skin to special blue lights that help break down bilirubin so it can be more easily excreted. In severe cases, exchange transfusions might be necessary, where the baby's blood is gradually replaced with donor blood to quickly reduce bilirubin levels. In adults, treatment is focused on addressing the underlying cause. If jaundice is due to an infection like hepatitis, antiviral medications might be prescribed. For alcohol-related liver disease, stopping alcohol consumption is crucial, and supportive treatments may be given to help the liver recover. In cases of obstructive jaundice, the goal is to remove the obstruction. This might involve surgical removal of gallstones or the insertion of a stent to keep bile ducts open if they're being compressed by a tumor. In some cases, a procedure called ERCP, or endoscopic retrograde cholangiopancreatography, might be used to diagnose and treat bile duct problems. As for jaundice caused by hemolytic anemia, treatments might include medications to suppress the immune system if the anemia is autoimmune, or blood transfusions in severe cases. At the end, while jaundice itself is often not dangerous, it can be a sign of serious underlying conditions. So, any unexplained jaundice, especially in adults, should be evaluated by a doctor immediately. Now, we want to hear from you. Have you or a loved one ever experienced jaundice? What were the symptoms like, and how was the condition treated? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.